What's the first thing you think of when you hear the word drug addict? Is it junkie, dirty, homeless, scum, loser, a failure? Well, what about that person's name? What about their story? For about the next 5 minutes, I want to ask each and every one of you to listen to what I have to say. Keep in mind there's a difference between hearing my words and actually listening to them. I want you to listen. Today I'm going to advocate for many who cannot advocate for themselves because they live in a world that silences their voices with these derogatory and dehumanizing labels. Many of you know the word stigma. Stigma is a noun. It is defined as a mark of disgrace or infamy, a stain or reproach, as on one's reputation. Many of us know an addict. Nearly 21 million Americans have at least one addiction, yet only 10% of them receive treatment. Why is that? I spent the past 7 months studying the opioid crisis, the worst addiction epidemic in American history, and what I've learned is horrifying. The opioid crisis is currently devastating America nationwide, with drug overdoses killing more than 64,000 people per year. Our nation's life expectancy has fallen for 2 years in a row, and drug overdoses have surpassed car crashes and gun violence to become the leading cause of death for Americans under the age of 55. This epidemic has killed more people than HIV at its peak, and its death toll exceeds the casualties of the Vietnam and Iraq wars combined. Every 11 minutes, another life is lost. To make matters worse, opioid addiction has led people to seek heroin because prescription painkillers are difficult to obtain. And fentanyl, which is 50 times more potent than heroin, has crept its way into other drugs like cocaine, Xanax, and MDMA, only worsening and widening the epidemic. You may find some of these statistics hard to believe and wonder, how is this relevant to you? Well, too many kids grow up watching their parents struggle with addiction, and too many parents watch their children battle addiction as well. I interviewed representatives from the Shatterproof organization and volunteered at their recent 5K event in Reston, Virginia. This event was eye-opening. It was chilling, but also liberating to come together as a community of support. Shatterproof is a nonprofit organization working to spread awareness, encourage support for those recovering from opioid addictions, and transforming addiction treatment in the United States. During my interview with Shatterproof representatives, I spoke with Caroline Davidson from the National Treatments Initiatives and Stacey Gerard on their communications team. These two brilliant women offered me many insights. Stigma reduction goes well beyond educating people. It means changing policies, changing language, and mobilizing people impacted by addiction. Stigma prevents people struggling from addiction from pursuing and maintaining sobriety. Many people perceive addiction as a moral issue and believe people with substance abuse disorders are making a recreational choice to use drugs. Unlike people with other chronic health conditions, those in recovery from addiction are blamed for the disease. This stigma creates shame, guilt, and fear, which prevents millions of people from pursuing the treatment they need. A 2007 study showed that almost 40% of college students avoid treatment for addiction because they fear social stigma. When many in our communities treat people with substance abuse problems differently than they treat people battling other serious illnesses, they discourage them from asking for help. Reducing the stigma associated with addiction will not be easy, as authority figures have spread misconceptions for generations. However, to shatter stereotypes and negative connotations, society must become more inclusive if we want people with all types of health problems to receive the help they so desperately need. Communities must be better educated about the seriousness of addiction, including its physical and psychological effects. Addiction is a difficult challenge, and if its victims aren't inclined to come forward to seek help, it's practically unsolvable. Another major issue with opioid addiction is that news coverage focuses on white and upper middle classes. There's ignorance about race, gender, and age. Many victims start out as patients. A patient is prescribed opioids, and over time they become dependent. And when their prescription expires, turn to the streets to satisfy their cravings. Society, corporations, and doctors are accidentally or willfully ignorant and perpetuate the crisis. While there may be a genetic component that predisposes some and puts them at a higher risk, their mental and physical illness often go hand in hand. Therapy is also a necessity. What I'm asking of you today is to walk out of here with a different perspective. Those suffering from substance abuse are people, not their addictions. Understanding addiction on a neurological level is important as it scientifically explains this is not simply a conscious decision to get high. Your body physically forces you to pursue drugs. How we understand addiction is important, but how we discuss it is even more important. These people aren't simply junkies or drug addicts, they're suffering from a combination of illnesses. Small changes in the way we speak about addiction and those suffering from it goes a long way towards helping people feel supported versus condemned. Through education, understanding, and support, communities everywhere can help to eliminate the stigma associated with people suffering from substance abuse. We're not all doctors, but we are all members of a community who can inspire change. Change for a more supportive, inclusive, and understanding environment that helps people to become the best version of themselves. It's time to step up, shatter stereotypes, and stand together united. Opioids may hijack the brain, but we can outsmart this epidemic. All we have to do is work together, not against one another. Thank you.